Hello family and friends, my name is Stephanie Monique and I am the office coordinator here at the Sleep Center. Today we want to cover some things to get you ready for your sleep study. Before your overnight sleep study, please be sure to go by Longtown Medical Park to pre-register for your sleep study. Here you will verify your insurance and pay any co-pays or deductibles. It's time for your sleep study. Please arrive at the Sleep Disorder Center located at 1845 South Green Street between 7 and 7:30 p.m. Be sure to ring the doorbell. What do you need for your sleep study? I'm glad you asked. A few things that you need to bring. Medications that you may need that night leading into the next morning. Any sleepwear, toothpaste, toothbrush, shampoo, deodorant, or special pillows, please bring those items with you. If you have diabetes, please bring your testing equipment and any other items that you may need. If you are coming for a CPAP titration, please be sure to include your mask and your tubing. Some of the things that we're covering you will find in this booklet. You will receive one of these booklets, so let's take a look. Things to do. Please be sure to have dinner before you come. Refrain from using oil, cream, lotion on your hair, your face, arms, or legs. Remove any hair pieces that may restrict access to your scalp. Avoid caffeine after 9 a.m. the day of your study, and avoid napping the day of your study. Please be sure to know that you can have someone to stay with you. That person just needs to be authorized. Anyone that is sleeping here under the age of 18 must have adult supervision to stay with them.
So what happens after your sleep study? If you just underwent your first sleep study and was diagnosed with sleep apnea, you will be prescribed CPAP therapy. If you have chosen a durable medical equipment provider, your prescription will be sent to that company within 1 business day of your study. We ask that you do not go directly to that company for service after your study. They will not have the proper information they need to help you at that time. In most cases, after a diagnosis of sleep apnea, you will be scheduled for a return sleep study, which is called a CPAP titration. The reason for this study is to determine the pressure you need on your machine and confirm you have the best mask. This study is not to see how well you are doing on your machine since the first study. You may return and not have your CPAP equipment just yet. If you have just had your CPAP titration study, or this is a repeat study from previous years and have chosen a DME provider, we will send your prescription to that company within 1 business day of your study. We cannot send the prescription until the doctor interprets the study, so that we ask that you do not go directly to that company for service, as they will not have the proper information they need to help you at this time. Your sleep physician's office will contact you to schedule a 30-day follow-up once you have completed your sleep study. During this visit, your provider will check your compliance with the prescribed treatment and address any issues or concerns you may have.
Now we're going to cover some information about insurance and billing. It is the patient's responsibility to make the Sleep Center aware of any changes to your insurance. Your sleep study must be completed within 6 months of your office visit. If you are unable to do so, this office visit must be repeated with your sleep provider.
All right, family and friends, 2 things. Our responsibility to you and your responsibility to us. We promise to work with you as best as we can to make sure that you have the appointment that you need. Now, your responsibility to us, we really need you to confirm your appointment. We will call you prior to your appointment to confirm you. We will also call you the day of your study to confirm your appointment. If you miss any one of those calls, please be sure to return our calls to confirm your appointment. This just ensures that you will be here and we will be here to service you.